So how many of you have worked with a child who has challenging behavior? And what are some of those problem behaviors that you're seeing? Elopement, so leaving an area without permission, right, or supervision. What else? Aggression. What does that look like?
Hitting.
Yeah. Hitting, pushing, biting. What have you seen?
Self-injurious.
Self-injurious, head hitting.
Head banging.
Oh, head banging onto a surface. Yeah, yeah. Other behaviors? Yeah.
Property destruction, like flipping furniture or breaking windows.
Yeah, wow, that's intense. Yeah, property destruction, right? So all of these are challenging behaviors. And challenging behavior is part of typical development, but most of us outgrow challenging behavior, and we tend to outgrow it as our language and communication skills increase. When we're talking about students with autism, we tend to see that those communication skills don't take off as easily, and so problem behavior persists. So what we're going to talk about for a little bit now is challenging behavior. I'll give you sort of the foundations. This should be review for most of you, and then this afternoon we'll pick up from this and talk about some interventions. So, as you all have already highlighted, about 94% of individuals with autism also have challenging behavior. And this can present negative short-term outcomes, like loss of instructional opportunity, loss of social interaction opportunities, teacher rejection, peer rejection, injury to themselves or to others, as well as negative long-term outcomes. So we end up with poor educational, academic outcomes. We end up with high risk for death and injury. We end up with more intense supports and services, including restraint and seclusion from the community. So without intervention, these kids are in big trouble. These are some of the challenging behaviors that are most common among individuals who have autism. A lot of these are some that you all have already mentioned. We know that behavior is individual and that the topography or the form of that behavior is going to vary across kids. But in general, we can say the phenotype or the group of characteristics associated with autism tend to reflect these sorts of behaviors. So Albert Einstein is quoted as having said, if I had an hour to solve a problem, if I had an hour to save the world, I would spend 55 minutes defining the problem. And I like this quote with respect to challenging behavior, because often when we go into schools, or we go into homes, or we go into centers, the teachers and the parents want help right now. Fix the problem, stop the glass from shattering, stop the head from banging, stop the child from running away. And what we usually say is, okay, we'll get there, but we're going to spend most of our time in the functional behavior assessment piece, trying to figure out why this behavior is happening, so we can figure out what variables we need to manipulate, what skills we need to teach, and what tools we use to teach those skills. So this is the Wabash River. It runs right through campus, or right next to campus at Purdue. And I have to get my notes because I can't remember all the details of this story. But this is a common story. I don't even know where it originated, but you've probably heard iterations of it, possibly. But I think it's really relevant to challenging behavior. So, 3 people were having a picnic next to the Wabash River, and they looked up and all of a sudden they saw a child floating down the river. And one of them says, oh no, let's jump in and save the child. So he jumps in, he gets the child, he swims over to the shore, and he puts the child on the shore. And they look and another child is floating down the river. And they jump back in and they get the child and they go back to the shore, they dry the child off and they're back on the shore. And they look and they see 3 more children. So what do? One says, we need more life vests. If we have life vests, we could throw all the life vests to the children floating down the river and we'll save them that way. The other picnicker says, no, we don't need life vests, we need more people. If we had more people, we could all be jumping in, we could all be saving. I could take 2 kids at once and we could all be swimming to shore with our kids. And the third picnicker gets up and starts running up the river. And the other 2 are saying, where are you going? What's going on? We have to save these kids. And he says, I'm going up the river to see who's throwing these kids in the water. So that's what we talk about when we think about prevention science, right? Rather than adding more interventions, life vests, rather than piling on more services, additional people to swim and get the kids, we're going to go up and figure out what's happening at the beginning, what's causing this issue, and let's intervene up there so we can prevent the kids from getting in the water in the first place. So this is sort of that prevention science, and this is what functional behavior assessment is really all about, is figuring out what's happening upstream and how can we change that so that we don't end up with these negative outcomes later on. So before we can change a challenging behavior, we have to figure out why it's happening. So Michael John Greco is a faculty member in Vermont. He does a lot of work with paraprofessional training, great research, but he also is a very talented cartoonist. So So he does great cartoons sort of poking fun at some of the things we do in behavior analysis and in special education. And so here, after a hasty special education placement for behavior problems, school officials were embarrassed to learn that Marty really did have ants in his pants. Again, if Marty had a functional behavior assessment, maybe we could have solved that problem. So what we've been talking about so far this morning is communication, and that theme runs through with challenging behavior as well. Communication is really what problem behavior is all about. The individual is communicating something, and that problem behavior is the link to outcomes in their environment. So if we can leverage the tools we have, whether it be mobile technology or teaching practices or both, we're able to provide a different response that the individual can communicate instead of relying on problem behavior. Challenging behavior also is more likely to occur when individuals have skill deficits. So if I don't have the social skills to navigate a difficult interaction, so I'm thinking about like 4th grade typically developing girls, right? If you've been around a 4th grade typically developing girl, there's a lot of really difficult social interactions. You've got to have a lot of skills to be able to navigate that changing world. When we're talking about people with disabilities, they also need a lot of help sometimes navigating difficult situations where they don't necessarily have the problem-solving skills, the communication skills, the academic skills, the social skills to get through that. This should be very familiar, right? Challenged behavior, or all behavior, has two properties. The form, which is what it looks like. That's when you're working with parents and you're working with teachers. They're really good at telling you about the form of the behavior. They have a harder time thinking about behavior in terms of function. Like Matt was talking about earlier with verbal operants, we tend to look at the form of the behavior. She said bear, versus the function. Well, was she manding for a bear? Was she tacting a bear? Was she asking a question about a bear? And so the same properties pertain to challenging behavior. And as you know, there's two main categories of functions for any behavior, but specifically challenging behavior. One is positive reinforcement to get something, and one is negative reinforcement to get away from something. This is a slide I usually show families when I'm teaching them, or teachers when I'm teaching them about positive and negative reinforcement with respect to challenging behavior. And so what they're supposed to identify is that both items on each list, things that kids want to obtain and things that kids want to avoid, are the same, which should tell them that they need to be looking at the individual level rather than saying, well, she has autism and so she's probably not going to like attention. We all know that kids with autism don't necessarily not like attention, right? In some cases, attention can be a really valuable reinforcer for all of us. So we're looking back at the individual level rather than assigning generalities to an entire population. When we're thinking about intervention development, it's also important not just to attend to the form, but also to attend to the function of the behavior. So if I'm the consultant and I get called in because a child is hitting, and I say, well, let me just pull out my hitting intervention. When the child hits, you're supposed to do planned ignoring, so you're going to turn your head, avert your gaze, and not respond to the child for 5 seconds or until the hitting has ceased. Okay? Well, that might be really an effective intervention if the child is hitting to get access to your attention, because now you're showing the child hitting no longer accesses attention. But if the child is hitting to escape an activity, and I just removed myself and therefore all of the demands right along with me, then I'm actually not going to be very effective at reducing hitting. If anything, I'm teaching this child, here's a really good way to get out of work. And if the child is hitting themselves, like self-injury, perhaps they're hitting it for automatic reinforcement. In other words, if you push your ear really hard, there's a momentary change in pressure, and that can alleviate some pain. Okay? So if I'm turning my head away and averting my gaze, that's probably not going to have an effect on the child who's hitting their ear to decrease pain. Likewise, if I come in and I say, oh my gosh, she's crying and she's grabbing toys and she's calling names, here's 3 interventions. Teacher, go ahead and implement all 3. And they all have a lot of components, and you're going to need to do this perfectly or the behaviors aren't going to go away. That's probably not going to be feasible for the instructor or for the parent. But if I would look to see that crying, grabbing toys, and calling names all serve the same function, which is to get attention, then I could say, let's teach her a better way to ask for attention, and we can address all those behaviors simultaneously. So have any of you participated in a functional behavior assessment before? And what does that generally look like? What goes on in a functional behavior assessment?
Depends on which version you use. We do everything from interviews to direct observation to we run essays in our schools.
Fantastic. So you do some interviews of like parents or teachers?
All the above.
Fantastic. Good. And then you're doing some direct observation of the behavior in a natural setting.
And then we're doing experiments.
And then sometimes you're testing specific environmental variables to see how they pertain to behavior. Good. Does anybody do an FBA books a little bit different? Or has maybe some of those pieces, but not all of those pieces? Just the same. Okay. So well, oftentimes when I go into a school and I say, have you done an FBA? They say yes, and here it is. Right? So they confuse a functional behavior assessment with a document. Right? So functional behavior assessment is not a document, it's a process. It's interviewing, it's collecting data, it's making decisions based on those data. And sometimes the decision is, we need more data, and then you go to do a functional analysis. Okay? So the first step is really helping folks to understand that a functional behavior assessment is not a piece of paper, it's a process, it's detective work, it's investigating to figure out what's happening upstream. Likewise, when we think about decreasing challenging behavior, we have a problem with our belief system, right? So when a student doesn't know how to drive, don't cheat, don't look ahead. You got the slides, don't cheat, don't look ahead. When a student doesn't know how to drive, what do? We teach them how to drive. When a student doesn't know how to wash your hands, we teach her how to wash your hands. When a person doesn't know how to read, we teach them how to read. But when a child doesn't know how to behave, what do we often do? Or what do we see others doing? They punish, right? Discipline, right? What sort of, I was filling out, my son has an IEP, and I was filling out the parent questionnaire, and it says, what do you do to discipline your child? I was like, oh, that's a poor choice of words. Right? Well, we have clear expectations, we teach those expectations, and we reinforce them when he meets those expectations. Is that what you mean by discipline? So we need to change this belief system. So instead, we're focusing on teaching students new skills, new behaviors, and new coping strategies, and we do all of this in a prevention science fashion, so before they have the opportunity to engage in problem behavior. Because the more they engage in problem behavior, the more they practice it, and the more they practice it, the better they get at it, right? So we want them to be practicing appropriate communication skills instead. So this is my last slide, and then we'll shift, just so you have an understanding of where we are. ABA uses what's called a biobehavioral approach. So we don't necessarily ascribe outcomes to a specific label. We don't say, well, she has this disability, and so these are her life outcomes. Instead, we understand that folks come to the table with their own skills, with their own strengths, with their own deficits, and that the environment also has lots of pieces that influence what skills, strengths, and deficits are highlighted for that individual. So this is a model of this biobehavioral approach from CDC. And this model is really looking at the issue of obesity. So obesity is an outcome that leads to even worse outcomes, including higher risk for disease. Obesity occurs first because there's an environment, right? So we have a work environment for individuals, we have a home environment, we might have a community environment as well. Within those environments, the individual can perceive some stress, right? So I've got a lot of work, I've got a deadline coming up, or I'm at home and I'm going through some crises at home. Maybe they're financial, maybe they're marital, maybe they're with aging parents or children. And these factors can lead to obesity, right? They can affect dietary behaviors, they can affect physical activity, which can lead to obesity, which can lead to higher risk for disease. But we know that we can change some of these factors, and we can change to what outcomes they lead. So we can implement an intervention based on eating awareness, right? Become more aware or more mindful, as the common term is right now. Become more mindful of what you're eating, what you're putting in your mouth. That can affect your dietary behaviors, which could reduce obesity. Become more aware of your physical activity. Maybe implement a self-management strategy where you've got physical activity or physical exercise in your day. Monitor your physical activity, get yourself a Fitbit, and then you're going to hopefully reduce obesity and reduce disease risk. This same model can be applied to challenging behavior. So if we were to replace obesity with challenging behavior, we were to replace disease risk with outcomes of challenging behavior. So worse in school, academic, social, quality of life outcomes. We still have the same environment. Rather than perceived stress, we might have diagnoses, right? Autism, other disabilities. We might have limited functional communication. Individuals with autism are being shown increasingly to have higher levels of anxiety. Higher functioning individuals with autism are being shown to have higher risk of depression, right? Associated with anxiety, associated with some of these other issues. We can mediate some of these this link between the diagnosis and the skill deficits with or the profiles with challenging behavior, so we can understand that behaviors occur to get something or to get away from something, and we can influence how individuals engage in behaviors to get things and to get away from things. And that's where we implement our interventions. And so this afternoon, we're going to talk about a specific type of class of interventions, which are really interventions based on mobile technologies. So we'll be talking about how to use mobile technologies to reduce the link between the environment, whether it's within the individual or in their surrounding environment, and their engagement in challenging behavior. Hopefully to break that link so that we end up with more appropriate behaviors and more positive life outcomes.